What is Mycoplasma infection in cats? Have you ever wondered what happens when a cat gets a Mycoplasma infection? This type of infection is caused by bacteria from the Mycoplasma genus, including Mycoplasma felis, Mycoplasma gatii, and Mycoplasma feliminudum. These bacteria are quite unique because they do not have a cell wall and can survive without oxygen. This allows them to live as parasites inside or on the surface of a cat's cells, particularly affecting red blood cells and tissues in the respiratory tract. Mycoplasma infections can lead to two main health issues in cats: respiratory disease and blood-related disease. Let's start with respiratory Mycoplasma infection. Mycoplasma felis is often linked to upper respiratory tract infections in cats. The upper respiratory tract includes the nasal passages, sinuses, throat, and voice box. When a cat has a respiratory infection, you might notice symptoms like sneezing, coughing, and discharge from the nose or eyes. This discharge can be clear or colored. Other signs include inflammation of the eye membranes, lethargy, and a decrease in appetite. In some cases, especially in very young, old, or immunocompromised cats, the infection can spread to the lower respiratory tract. This can cause more severe symptoms like difficulty breathing, rapid breathing, fever, and a higher risk of pneumonia. Now let's talk about the blood-related Mycoplasma infection, also known as feline infectious anemia. Certain Mycoplasma species can attach to red blood cells. This causes the cat's immune system to mistakenly attack and destroy these cells, leading to hemolytic anemia. Symptoms of this condition include pale gums, weakness, lethargy, jaundice, increased heart rate, loss of appetite, weight loss, and sometimes fever. Transmission of this infection often occurs through flea bites, which introduce the bacteria into the bloodstream. To diagnose a Mycoplasma infection, veterinarians usually perform a clinical examination and blood tests. These tests help detect anemia and identify the presence of Mycoplasma organisms. In some cases, polymerase chain reaction testing may be used to pinpoint the specific bacteria involved. Treatment typically involves antibiotics that are effective against Mycoplasma, along with supportive care to manage symptoms. It is also essential to address any secondary infections or complications that may arise. Preventive measures include controlling fleas and maintaining good hygiene. In summary, Mycoplasma infection in cats can lead to respiratory illness or anemia, depending on the species involved. Early veterinary evaluation and treatment are important for managing the disease and improving health outcomes, especially for vulnerable cats.